what's called a garbage can diagnosis. In other words, when a patient comes in suffering from chronic pain, fatigue, headaches, generally speaking, the primary care physician will run a series of tests. If that series of tests doesn't bring anything back that is positive, oftentimes the patient is diagnosed with fibromyalgia. For many years, it was considered to be a mythical diagnosis. In fact, most physicians just totally didn't believe in it, and oftentimes thought that the patients had a psychological problem and would prescribe some psychotherapy for them. Today, it's pretty well researched that fibromyalgia does exist, that it exists for a number of reasons. They range from nutrient deficiencies, vitamin deficiencies, past accidents. Oftentimes patients will say that something traumatic happened in their life. Ever since then, they've had this tightness and soreness in their back, they've had these headaches and chronic fatigue, and they can trace it back to one traumatic incident. Other times it runs in the family, so the mother has had it, the daughter has had it, the grandmother has had it. When treating a fibromyalgia patient, you have to look at all different aspects of it. The nice thing that we do here at Hatch Chiropractic is we look at the nutritional deficiencies, we look at the vitamins, the minerals, the metabolism, even the amino acids. We also look at the alignment of the spine. We look at the fascia. There's a lot of theory out there that it is widespread fasciitis. So most people have heard of plantar fasciitis. It's kind of the soreness of the foot, it becomes very inflamed and tight. This is kind of believed to be fasciitis throughout the whole body. So fascia runs throughout our whole body and connects at different points. When that becomes very inflamed and tight, it creates this chronic pain throughout our body. Chiropractic and acupuncture are extremely effective at treating this. Oftentimes medication just won't cut it, and most patients need some deep tissue work, and they need some spinal alignments. The other thing is that they need to find out where the deficiencies are. Oftentimes they're deficient in some of the B vitamins, vitamin D, magnesium. There's a wide variety, calcium, that these types of patients are deficient in. And once those deficiencies are corrected and we're able to release that fascia and realign the spine, it makes a huge difference.